country. We were here in the United States, and I've lived here since then. I was an English teacher back in India, came here and did my RN nursing program, became an RN. I was working as an RN until 2010, and February of 2010, when I had a routine OBGYN visit to my doctor. It was a routine appointment, so I had to let my work know that I was going to be late, and I went into the appointment. And when she saw me, she said that she was suspicious of something in my abdomen and she wanted to do an ultrasound. So I went upstairs to get the ultrasound done right away, and I told myself, I'm sure there's nothing wrong with me. It's probably the fibroids, and she's just concerned, overly concerned. I always had this feeling that doctors here are overly concerned about little things. So I went ahead and did the ultrasound anyway. And before I walked out of the ultrasound office, the radiologist walked in and told me, "I'm very sorry to inform you, you have ovarian cancer." And I was blown. I could not take it. I was in total denial, because I always considered myself a health conscious individual. You can call me a health freak or whatever, but I was a vegetarian all my life, and I ate the right things, I thought, and did the right things. So this was a big shock to me, and I thought there has to be something wrong. Maybe the radiologist doesn't know what she's talking about, and maybe the test went wrong, maybe the wrong person's results, or whatever, how your mind is always thinking that this is not true. I couldn't believe it. I just didn't believe it. I said, there must be something wrong, But how could you tell from an ultrasound? I was questioning the radiologist stupid questions, and she was trying to explain it to me. It didn't go through my head. And I walked out of the room, and my niece is an oncologist in Baltimore. So the first thing I did was call her, hoping that she'll say, "Oh, no, that doesn't apply to you," or something, I was just hoping for good, positive words from her. But all she could tell me was, you have to do this test, you have to do the full body CAT scan, you have to, make sure that this blood work is okay and all that. So I went ahead and agreed to do all those tests, and the day went by, one by one. I did the blood test at first, and then did the CAT scan, and everything was in favor of what the radiologist told me. So I went back with my OBGYN, and she also confirmed that this ovarian cancer is very real, and the ultrasound can really tell the cancer, because the cancer cells look totally different than the non-cancer cells, so it's very easy to tell from the ultrasound pictures. So by the end of the day, everybody was pretty sure that the cancer was very real, and what they told me I had to do, the next step was for me to make an appointment with the surgeon and go see a surgeon immediately. I wanted to postpone it a little further, but they wouldn't let me do that because it was a high risk. So another niece of mine who is an OBGYN in town also got involved. And so the surgery was scheduled, and it was done on March 16th at St. Luke's in Houston, because they said that MD Anderson does a more thorough job of this, and I have to go there to get my surgery. It was at the next hospital, but my biopsy was done there. So they chose the surgeon for me, and on March 16th of 2010, I had my surgery. My uterus, my ovaries, and my fallopian tubes were taken out. After the surgery, that's when they did the staging, what you call staging, in the sense when you take out a cancer tumor, they have to do certain testing to find out what stage it is so that they can treat accordingly. And the prognosis was not good. The surgeon called me a few weeks later, and she told me that I had stage 3 ovarian cancer, which means it has gone to the lymph nodes outside of the ovary, which means the bloodstream has the cancer cells, which means it can settle in any other organ at any time, and that can cause further damage. So that's what stage 3 means. Stage 4 is the end stage, or the last stage, which means other organs also have cancer besides where the cancer started. So I was diagnosed with stage 3C, and this is what my surgeon told me. She said, you have clear cell carcinoma, which means the cancer is a very aggressive cancer. It's going to spread very fast, and the chemo is not going to help. Chemo is the only option available at this point, and even if you do chemo, you will be cancer-free for a few months, but at the most, within a year, your cancer is going to come back, and once the cancer is back, it's a matter of time because we don't know how long your body can fight it. So once the body gives up, it's dead. So let's say 1 to 3 years is what she gave me. 1 to 3 years, but those 1 to 3 years are going to be very miserable for me because I'm going to be in and out of hospital, full of complications and surgeries, and it's not going to be a smooth ride from now on. That's the prognosis I got. So of course it was very devastating, but one thing was clear in my head. I've been a nurse for this long, and I've seen so many patients lose their quality of life because of these prolonging treatments, especially on dialysis. I've seen a lot of patients come to dialysis from kidney failure, and they would come to us in a very good shape, and then slowly the dialysis would take their life away little by little. They had no quality of life, and finally, they had to face death in a very short time. So, going through this in your life, has changed my perception a lot. So I was so determined not to do chemo. The 1 to 3 years of life that she said I had is going to be miserable. And in her words, the exact word she said was, you're going to have complications, hospitalizations, and more surgeries. So these were the 3 words she used. And I said, I do not want that life. So I told my family, if it comes to death, I would rather face it now than go through suffering for another 3 years and then die later. But I'm going to fight this and see what other alternative therapies are out there to cure this, or to, treat it, or at least to have a peaceful death. So that was my goal. It was, I didn't know that anything better. So I did. That was the thinking even before I had my surgery. I told my family I didn't want chemo, no matter what. I didn't even know whether I needed chemo, but I know how harmful it is to you. I just didn't want it. So after that, we did our research, but before my surgery, there was a relative of mine from India heard about my story, and she called me and she said, there's one naturopath in Coimbatore, his name is Subramanian, and I want you to go see him because, I've visited so many nature cure centers, but he's a little bit more, reliable, and I like his treatment, his way of treatment. When she first approached me, I was not convinced. I did not talk to him, but she kept calling and calling and calling. And just to say, yes, I did, I called and talked to him. And even then, I was not convinced. I was like, yeah, right, nature cure is going to cure me. And I hung up the phone, and that was it. I forgot about it. But then after I heard all these prognoses from my surgeon, I went back to him. I picked up the phone and talked to him again. And this is what he told me. He said, come over. You don't have to do chemotherapy, but if in your mind you feel like you have to do it, go ahead and do it. But it would be better for your body if you don't do it, and you will be cured of cancer, and you're not going to die of cancer. You're going to die of some other cause. So that's what he told me, which was very encouraging. I didn't know whether to believe him, but at the point where I was, in the shoes I'm in, anybody would have taken this on. This is something, everybody wants to hear. And I took his words. I did call just about all the other alternative medicine groups in India and all the big clinics and hospitals and Ayurvedic clinics and Siddha people and all the well-known Kerala stuff and Madras stuff. Everywhere I was looking up on the internet, but the only person who assured me was him. And I went there. I went to Coimbatore. 5 weeks after my surgery, on April 28th, I landed at his clinic. He has a clinic where, you can stay and get treated. And he feeds you, and you can live there. And I stayed there for almost 2 months, and then I moved from there to my dad's place in India, stayed there for another 2 months, and then I came back to the United States 4 months later. My cancer marker before my surgery was 442. That's the ovarian cancer marker. It's supposed to be under 30. For normal people, it's under 30. You never get a 0, but anywhere between 0 to 30 is normal. And after my surgery, it came down to 58 because they took a cantaloupe-sized 19-centimeter mass out of my body. And then after I came back from treatment, it dropped to 8. And it not only was 8, but it has remained 8 for the entire 2 years that I'm here. So I'm pretty much cured of cancer, in his words. And to this day, I have the same marker, 8 or a 7. Every 3 months I get checked, and my marker has remained 8 or 7. Which is very wonderful, because a lot of normal people even have a marker higher than that, which doesn't really mean anything, but the lower the better is what I hear from the doctors. And the things that I did would surprise you, because there was really no supplement that I took, not a single tablet. And there was no medication, no Ayurvedic medication, no Siddha medication, no herbs or anything. So all I did was, I would call it lifestyle modification. So anyway, what did I do over there? Once I got there, he wanted to detoxify me, because I was full of toxins. And so in order to detoxify, he did a certain steps, like a cleansing step. You might have heard about a lot here, like, different ways of cleansing your body. So I did the cleansing part to get rid of all the toxins that were built up in me. And then the next step was not to feed any toxins, because that's what's contributing to it. So the intake has to be toxin-free and wash out what's inside. Were the 2 things I did. So basically, so what I did there was, first I had to give up my food. That was the hardest thing to do, because he has a special regimen as to what to eat. The biggest part was you have to eat a lot of fruits. I was on 12 days of fasting. I was taking only juice, fruit juices, fresh fruit juice, and I fasted like that for 12 days in a row. And the rest of the time, it was 90% of fruits and 10% of something else. And this was my major treatment plan. And the second thing that I had to do was cleansing out what I had in me. So I have built up a lot of toxins, and I have, whatever I have, all the impurities in me had to be cleaned out. So he asked me to do enemas, and those enemas has helped me a lot. These are not the regular enemas that you see here, which has soap and other chemicals. These are just tap water, chlorine-free tap water enemas. So I did those, and he also had me do what you call oil pulling in the mouth, because a lot of toxins are built up in your oral cavity. So when you pour oil and swish it and spit it out, you get rid of a lot of the impurities or toxins or whatever you call it that's built up in our mouth cavity. How I did it and how it helped is what he's here to talk to you about. And I'll be, feel free to ask me any questions after he's done talking. I'll be happy to answer. And I'm here locally in town in Austin. So if you guys, any of you need any help, any counseling, or any ideas, or any tips to how to do this at your own house, feel free to call me. I'll be happy to help you. And Dr. Subramanian has been practicing this for over 35 years. Actually, a cousin of mine, and not the one who recommended me to him, there's another cousin who was suffering from asthma, and she was a very severe asthma patient. She has not been out of hospital for more than 2 months. That's how bad she was when she went to his clinic. This was 25 years ago. And she came home and did everything as he asked her to do for a whole year. She was very strict with everything that she had to do. And she has been asthma-free since that time, for the last 25 years. So this system does not work just for cancer. It works for any disease, because basically your body is a mechanic. It can fix any problem. We just don't use it that way. And this is not only for cancer. This is for anything, any disease, and it doesn't have to be a disease. Even if you are disease-free, you can still benefit from these systems, because you can have a better life, better health. And that's one of the reasons why I'm here talking my story to everyone. We don't realize what a good mechanic our body is. When I walked in, I saw the art of living words, and that's what, struck me. Living is an art. We just don't pay attention to the art. We just get caught up in everything else. So let's listen to what that art is and how he treated me and how that helped to cure my cancer. Thank you.